You may have read the widely read piece, RIP Marcus Welby, MD, that talked about the demise of the traditional family doctor. Fortunately, there's a renaissance with a new model that is emerged, I think, of as kind of two parts Marcus Welby, one part Steve Jobs. And some call it retainer-based or direct care or concierge medicine. I like the term direct primary care, and I'll use that today. And we've heard very consistently that from practices in that model that traditional health IT and EMRs are so provider and insurance centric rather than being patient centric. They really aren't supporting that type of practice. And the fastest growing direct primary care practices have embraced an approach that's referred to as patient relationship management, that it's low overhead but allows what I'll explain here. And so there's this framework. I have this bow tie, and in marketing, you have this notion of acquisition. There's this notion of funnels, and I've kind of flipped that on its side, and then that continues through retention, which is really the key to any business of any type, is maintaining a healthy base. So in order to do that, the first exposure one's going to have typically to a practice is a smart web presence that's maybe a blend of a few different things I'll touch on. And then they're going to have a great, hopefully a great first experience with the practice, not get hit with the onslaught of paper forms that one normally fills out, and then they're going to have that first appointment. Typically this is where health IT is focused today, but as we all know, more than 99% of your life is not spent at the doctor's office, and that's the time when you maintain or return to health. And so that has been largely ignored in traditional health IT. So once that appointments happen, this notion of collaborative care is very important. Patients certainly playing a big role in maintaining and returning to health. And then finally, communication is not only helpful for the care side, but also in patient satisfaction and maintaining that relationship. So just adding a little detail to that, I won't go through this in detail just yet, but these are some of the elements that would go into that. And let me just step through how Avado is approaching that. So we'll start with a smart web presence, and you'll see kind of as you follow along down below where we're at. And so what we've done is made it very easy for a doctor to create a website. Unfortunately, most doctors' websites are really nothing more than an electronic brochure versus a rich, interactive, two-way platform. And with just a couple clicks, we enable that, and in the process create a patient portal that is much more than the limited patient portals that you see today that tend to be just one-way broadcasts versus something that's truly patient-centric. And in order to have a website full of content, we make it very easy to publish content, and I'll give you a couple examples. And then that can be targeted to either your website or to particular subsets, if people are logged in. And then that goes over to the patient side and what they'll see either on the website or within the logged in area. So that kind of starts the process, and then there's going to be that first experience. And I'll talk about, Debbie as an example of a patient that has gotten exposed to the practice, and she's received an email that has those first forms, and she's filled those out. Now, if she had already been a registered user of Avado, it's going to auto-populate those forms she's already filled out. It's certainly irritating for individuals to have to refill out that information. But if she hasn't, then she'll go ahead and fill that out for the first time, and it should be the last time she has to enter the information, and make it very easy to send that off to the practice. And then on her side, she's going to get a very rich environment to track her vitals, manage the health records that she's gotten from the doc, and it's going to create a health calendar, particularly if she's on some sort of care plan. And again, just make it very easy for her to interact with the practice. And let's say Debbie's had some treatment, perhaps she's had some back pain, and the provider historically has just perhaps handed her a piece of paper to kind of keep a little diary of what's going on with her symptoms, and if she remembers to fill it out and bring it back, then there's a little bit of useful information. The idea here is to make that much easier and just send off this message to the patient that's going to put reminders on their health calendar to update this information. She's going to receive notifications on her mobile device or in the web, and just give a quick hit and get back to what she's doing, and then in the intervening period, she's going to be able to send this information to the doc. So not only at the next appointment, but in the intervening times, she's going to be able to do that. And this is particularly important as increasingly docs are responsible for care in between the appointments, and that's why we have the notion of care beyond the clinic as our tagline. And finally, that ongoing communications is key. I mentioned the broadcast earlier. That's one way. We've actually created hundreds of medically relevant feeds that allow the provider to keep in touch with their patients with really minimal time. And they have the ability to send these messages or these communications as narrowly as just to their coworkers, as broadly as to their public website, or to subsets of their patients, perhaps just their female patients. And again, just to ease the process, a lot of docs are getting Twitter and Facebook accounts, and from the same place they can publish out to Twitter and Facebook. And so they don't have to go to 10 different tools to do that. So that just gives you a quick overview. Avado's name was inspired by a village in Italy where people live longer than anywhere else in the world. In fact, men live as long as women. And so for your practice and your patients to similarly have a long, healthy life, Avado enables you to have a patient-centric approach while keeping your overhead very low. And I thank you for your time.